So as I was doing my assessment, I was feeling that his craniosacral rhythm, so this movement, this opening and closing of the body, it felt like there was a very strong rhythm, is what I'll call it. However, I was feeling a difference between the left and the right side of the body. And so that's giving me this information as, you know, just for something for me to keep in mind as I do a treatment. Oh, this is how this is feeling. And so, you know, after doing maybe a couple of different treatments on him, I'd be able to say, oh, this is feeling much more even. Both sides feel like they're fully moving.
So I have a question.
Okay.
So if it's out of balance, do you just use life force energy, as in like Reiki, to balance it, or would you then go into a massage?
So with the craniosacral therapy, I would follow where it was feeling the most tense, and I would use some of the protocol that I've been taught. So whether or not, you know, so if I'm feeling the tension along the spine at any one point, or up in the head at any one point, that's where I would work. And there is an energetic quality to it, but it is also very physiological in nature. Craniosacral therapy does use that 5 grams of weight, so I would be using that to address the area where the tension is. So craniosacral therapy is very good at addressing headaches, back pain, neck pain, shoulder tension. I work with children also, so I see children with autism, children with ADD. I also see infants who are having difficulty feeding or thriving. A lot of the people who have come in to see me have maybe been in an accident also. And I'm working with John right now at one of the one of the areas that's often tense with people, which is right at the base of the neck. So right where the head and the neck come together. And this is where all the blood and the nervous supply goes out to the body, and so it's a very great area to work, so that the body's getting its proper nervous supply and the brain is getting its blood. So oftentimes when people are finished with a session, I should say that during a session, somebody who's receiving it sometimes doesn't feel much of anything at all because it's so light and gentle. Sometimes people feel hot or cold, or sometimes they will, you know, pain might come up while I'm working. And other times they just feel a relief. It just feels like, oh, this feels good. So a lot of different things can happen during a session. And then afterwards, it sometimes can take the body a day or two to kind of rest into the session. So it might take, some people will walk out and feel immediately better and just, you know, say this was just great. They might not feel anything for a little while. It might be a very subtle change that happens. Or I have somebody who says, always whenever it's 3 days later, I just feel really good. So sometimes it just takes that time for the body to settle into a session.
Have you treated patients who are suffering from paralysis?
I have. Yes. So, and it just, you know, it depends on, you know, what caused the paralysis and, you know, what kind of issues they're dealing with now. but, you know, I have seen several people, actually, you know, quite a number of people who've had some sort of paralysis. It is, I should mention as well, that is after they've, you know, gone through, it's not something that I would be doing craniosacral right at the time of injury. It would be something that would be afterwards. Okay, thank you, John. Did you have anything to share for the group? No, not at the moment, okay.
I always feel kind of spacey after a session, I don't know.
Yeah, yeah.
Oh, yeah, I do.
You do feel a little spacey? Yeah.
Kind of floaty. Yeah.
Thank you.